Welcome to Health Talk. September is National Ovarian Cancer Awareness Month. Today, you'll have the opportunity to meet Pikeville Medical Center's gynecological oncologist. Find out more about ovarian cancer. Understand the risk factors. Develop a plan to live cancer-free. Now, let's meet our guest.
I'm Holly Gallion. I'm a GYN oncologist at Pikeville Medical Center. I've been here a little over a year now, and I really enjoyed it. My training is in the treatment of women with gynecologic cancer, and I went to high school in Ironton High School in Ironton, Ohio. Then I went to Ashland Community College, University of Kentucky for most of my medical training, and I was on faculty at the University of Kentucky for many years till 2001, and then I went to Pittsburgh to work at McGee Women's Hospital, where I directed an ovarian cancer center of excellence. But my family's in Kentucky, my heart's in Kentucky, and after learning a little bit more about Pikeville Medical Center, I decided this is where I should be. So I've been here a little over a year. It's a great hospital. I've built a fairly steady practice. I've seen a lot of women with gynecologic cancers and really enjoy working at the hospital.
What is a gynecological oncologist?
A gynecologic oncologist is a physician who's had specialized training. So what we do is we have a 4-year residency in OBGYN, that's of course after medical school, and then we have an additional 3 to 4 year formal training in the comprehensive management of women with cancer. And that training allows us to do chemotherapy, advanced surgery for staging and tumor debulking, and also to prescribe radiation. So it's sort of a unique specialist. There's about 1,000 of us that are board certified in the United States. And what makes it unique is that we're able to take care of women from diagnosis all the way through their treatments, regardless of what they are. We're sort of the team captain on that, and through their follow-up. So it's a very comprehensive longitudinal management of women with cancer. In addition to treating women with cancer, we also specialized in more advanced gynecologic surgery and the treatment, prevention of cancer and risk reduction. So it's very comprehensive. So we do treatment, surgery, chemotherapy, and assist with the radiation. And we also work to prevent cancer.
I wish someone could explain ovarian cancer.
You know, ovarian cancer is the most common cause of death from gynecologic cancer. So it's a serious cancer. It's a cancer that starts in the ovaries, which are, small organs that are sort of tucked inside your pelvis, and the cancer cells move out of the ovary very quickly to the other organs. So they sort of seed the other organs in your abdomen, the small intestine, the large intestine, the liver, the diaphragms. So it has a very sort of unique spread pattern. The cancer, unfortunately, is usually spread by the time we find it, because as in any other cancer, if you can find it early, then you can cure it by just taking it out. But unfortunately, with ovarian cancer, there isn't a great screening test available for that. So usually by the time we find it, 85% of the time, it's already spread, at which time surgery is important, but additional treatment is needed.
I've always been concerned about the risk factors of ovarian cancer.
The biggest risk factor is just being a woman. The chances of getting ovarian cancer, the general population risk, if you look at everybody, is about 1 in 70. So 1 in 70 women will get ovarian cancer. It tends to occur around the time of menopause. So in the 50s is when we see the biggest incidence of ovarian cancer. So it's being a woman, it's age. Then there are other things that increase your risk. Having endometriosis moderately increases your risk. If you've never had any children, either by choice or from infertility, that also moderately increases your risk for ovarian cancer. One of the strongest risk factors for ovarian cancer, and it's important that everybody is aware of this, is your family history of cancer. If you've personally had a history of early age of onset breast cancer, that is less than 50, then you have an increased risk of ovarian cancer. If you look at your family members, if you see several members with early breast cancer, age 50 or less, or you have any close relative, mother's side or father's side, with ovarian cancer, you're at increased risk. So family history is the strongest risk factor for ovarian cancer.
Are there signs and symptoms of ovarian cancer that I should be aware of?
Well, you know, for a long time, we called ovarian cancer the silent killer because we didn't think that there were signs and symptoms. And back in the old days, and I've been practicing for a while, women would have these vague symptoms, and these are sort of what they are: pain in the abdomen or the pelvis, urinary problems, frequency, going to the bathroom too often, pressure in the pelvis. The other things, so it's sort of pain, urinary symptoms, abdominal bloating, just feeling full. And then the fourth thing would be like difficulty eating, like you get full too quickly. So they're sort of vague symptoms. And a long time ago, we ignored those symptoms. And patients might be going to the doctor for 6 months to a year with those symptoms before we diagnosed ovarian cancer. Now, because there's much more awareness that those four things can point to ovarian cancer, we're detecting it earlier now. So if you have any of those symptoms, albeit vague, and probably you don't have cancer, but if they persist for 2 or 3 weeks, you should be checked out by either your gynecologist or your family practice physician. Likely you don't have ovarian cancer because they are sort of vague symptoms, but you might, and it's very important to not ignore those.
Could you explain to me how ovarian cancer is diagnosed?
Ovarian cancer generally is diagnosed by feeling or seeing a tumor in the ovaries. And we do that with pelvic exams. That's why it's so important to get pelvic exams every year. So we can feel a mass in the ovary. The other thing that we do is imaging. Probably the best test to look for ovarian cancer is transvaginal ultrasound, where we put the ultrasound probe directly into the vagina and we can see the ovaries very clearly. So we can see small tumors in the ovary. So if you take early ovarian cancer, most of the time you're going to be able to see it on an ultrasound. There's exam, there's ultrasound, and then there is a blood test called CA-125. It is not we don't use it for screening in the general population like we do mammograms or pap smears because it's not a perfect test. But if there's a suspicion of ovarian cancer, then that blood test can be very informative.
I like to focus on prevention. Are there ways I can prevent ovarian cancer?
Ovarian cancer is to some extent a preventable disease. And the way that you can prevent ovarian cancer is, number one, birth control pills decrease your risk significantly. So if you've used birth control pills for 5 years, your risk of ovarian cancer is reduced by half. So that's pretty significant. The other thing, if your ovaries have been removed, you can have your ovaries removed, that decreases your risk 95%. We only recommend having your ovaries removed, however, if you have a strong family history. And being aware of your family history, and I mentioned that a little bit earlier, family history of ovarian cancer or early onset breast cancer is important, because if you know you have a family history of these cancers, then there are genetic tests that can be done to determine whether you've inherited a gene or not. And I work with a genetics counselor at the Cancer Center. We can do the whole family risk assessment. We can do the genetic testing after counseling. And if you do have an inherited predisposition on the test, it's called BRCA1 and 2, breast cancer 1 and 2 gene, then you start with early ultrasounds. You can take birth control pills to decrease your risk, but at age 35, if you've completed your family, we generally recommend having those ovaries removed. And that can be done through the minimally invasive little tiny incision surgery. I mentioned earlier that removal of the ovaries results in a 95% risk reduction for ovarian cancer, but it's not complete. There's still about a 5% chance in women who are really predisposed to get a cancer that looks and acts just like ovarian cancer. It starts in the lining of the pelvis and spreads and is treated just like ovarian cancer. The only difference is that you don't have enlarged ovaries. So there are some cells in there that can act like ovarian cells and turn into a cancer, and that's called peritoneal carcinomatosis.
I've been told that there is a connection between ovarian cancer and breast cancer.
There's definitely a association between breast and ovarian cancer. They're both, diseases of gynecologic tumors, organs. They're endocrine active. They tend to run together. So if you have one cancer, you're definitely more likely to get the other. And that is due to common gene changes and also some common risk factors.
Have there been advances in technology for treating ovarian cancer?
There has been, and I've been practicing for a few years now, there's been a great improvement in the outcome of women with ovarian cancer over the past really 20 years. And that's been a combination of more effective chemotherapies. Our chemotherapies now are much better tolerated, and the survival of women with ovarian cancer is 5 times better than it was 15 years ago. So there's been a significant improvement in the treatments that we can give for ovarian cancer. They're better tolerated, they're more effective, and so the outcome of women with ovarian cancer is actually quite good.
I want to live a cancer-free life. What are the steps that I can take?
Well, I think there are some really good steps that women can take to stay cancer-free. One of them is to learn as much as you can about cancers so that you know what screening you should have, mammography, pap smears, annual GYN exams, know your family history, and if there's a family history of cancers, for my cancers, it's breast, endometrial, uterine cancer, and ovarian that tend to run in families, but colon cancers, pancreatic cancers, there's a lot of cancers that tend to cluster in families. It's sort of just like if your family has a lot of diabetes in it, you're probably at risk for diabetes. So know your family history, talk with your doctor about it. So know about the cancers, know your family history, get your screening tests, including colonoscopies, and if you have any symptoms that persist, that are, even if they're vague, don't ignore them. Go to your doctor, ask questions, get examinations, get your screening test. And I think that if you learn about the cancers, if you get your screening, and if you have symptoms and you act on them, then you can definitely decrease your risk of cancer.
Thank you for joining us for Health Talk. If you have more questions about ovarian cancer, feel free to contact the Leonard Lawson Cancer Center.